When you go to the doctor and get advice or treatment for anything from an infected wound to heart surgery, it's likely that you think that there is research behind everything the doctor does. But unfortunately, you'd have to think again, according to doctor and researcher Stefan James.
We look at the guidelines that are given to us. In fact, only about 20%, 1 of 5, is based on research and evidence from trials. So in fact, most of the treatments we give patients are not well evidence-based.
So there is only 1/5 of all medical care that has good evidence, which is scientifically proven to work, according to Stefan James. A figure that shocks many. But now Stefan wants to change that in order to give patients the best possible care.
My mission is to improve health in the world.
Så där Ingrid, nu är det snart igång. Jag säger bara till ifall det gör ont.
Today, Ingrid Pettersson is having heart surgery. The operation itself is known to work, but it is still part of Stefan James's research. To find, for example, which is best, to open up the entire chest, or as with today, to insert a thin catheter.
Vi går upp med en ballong hit och sen blåser vi upp ballongen och då spränger vi ut klaffen så att det blir större utrymme. Och sen kommer vi föra en ny klaffprotes på en ståltråd nere från ljumsken.
During his education, he understood that for a long time doctors performed treatments without any scientific proof.
One example was modern to treat patients with phlebotomy, to open the veins and drain blood from patients for all sorts of diseases, including loss of blood, which is of course crazy and dangerous.
And early in his career, Stefan began to wonder if it might be so that even some of today's treatments were wrong. What kind of scientific basis exists? For example, he began to think about how he and his colleagues sucked out blood clots from around patients' hearts. Blood clots stop blood flow within a blood vessel and can occur anywhere in the body. But when this happened around the heart, doctors treated this by sucking out the clots to restore the blood flow. This simply felt like an effective solution. But when Stefan James looked at this more closely, he discovered that pieces of the clots could break loose and travel to the brain, causing a stroke. More importantly, the patients whose clots were not sucked out and instead were given other treatments, they made it just fine. So as it turned out, the operation was unnecessary, to say the least. The results of this study made the surgeon community begin to rethink things.
Immediately after we had published the results, the usage of sucking catheters diminished, not only in Sweden but globally. And so we could take away something that was ineffective and use that money to improve patients' lives.
Det var bra.
Väldigt bra. Klaffen sitter perfekt, eller hur?
Ja, helt perfekt. Snabbt gick det också. Ja, nu ska vi föra in alla uppgifter i vårt nationella kvalitetsregister.
Today, Stefan James investigates many different types of treatment. And he has developed a method where large amounts of data are collected, which can be used by researchers all over the world.
In order to do that and understand, we need many patients, patients that are reflective of the true clinical picture, old, young, men, women, etc., in order to be able to draw conclusions from the general populations.
A short distance from the operating room is the Uppsala Clinical Research Center, UCR. Here, 140 employees work to assist anyone in the world who is looking to collect data in a research project in the spirit of Stefan James. They help and advise large pharmaceutical companies, the U.S. Food and Drug Administration, and such universities as Oxford and Harvard. Doctors and nurses use a computer program developed in Uppsala in which they can enter all the numbers as Stefan did after today's operation. In total, 10,000 patients are involved, with everything from new medications, exercise, stomach ulcers, obesity, and new hip screws. When the data is collated against registries, the researchers can then find patterns where bad treatments are revealed and where the best treatments are found. And it all started with a simple question. Does this really work?
Hallå! Hej, nu kommer vi hälsa på dig.
With Ingrid Pettersson's operation today, among other things, data was collected to determine which is actually best, to use a catheter or to open the chest. Stefan James still doesn't know the answer, but the patient seems to be doing well anyway.
Hur känns det att vara med i den här forskningsstudien som vi erbjöd dig? Vi vill ju försöka förbättra behandlingen.
Kan den bli det?
Ja, du ser, ja, det här är tack vare det.
Ja, okej.
Att det går lite enklare och fortare och vi gör det säkrare så att det är...
Det är jättebra.
For me it feels really rewarding to be able to change the way we practice medicine so that patients throughout the world can receive better and more effective therapies.
But since so many medical treatments are not yet based on clear research, one may wonder if we should be afraid to go to the doctor. No, says Stefan James.
And I think you should not be worried, but you should also be demanding. You should ask your doctor, why do you say that? How can you say that? Is that really evidence-based? What is the evidence? Can you show me the evidence in form of a scientific paper? Or can you refer to some guideline document or common knowledge? Vad fint. Tack ska du ha.
Ja, tack själv.
Tack.